When people talk about lead in Michigan, most minds go straight to the Flint water crisis, which makes sense. That event was a watershed moment that forever changed how we view our public infrastructure and the safety of the water coming out of our taps. But while we've made strides in water safety, there is a much quieter, more common reality sitting on the walls of nearly 70% of Michigan homes. We need to talk about why the lead problem in our state is very much alive and why it's about more than just pipes and the urgent work required to support the long-term health of our families. I'm Samantha Pickering, the Public and Environmental Health Policy Manager here at Michigan Environmental Council. And like many of you, I love our historic Michigan homes. I appreciate the original hardwood trim, the unique architectural character, and those cool vintage light fixtures that you can't find in modern builds. However, we have to face the data. About half of our housing stock was built before 1980, and a massive chunk was built before 1978. That year is a critical dividing line because it's when lead-based paint was finally banned for residential use. And while many people immediately think of children physically eating paint chips as the primary source of lead poisoning, there's another insidious reality. Another incredibly frequent culprit is actually dust. And as old paint ages, it becomes brittle. So when a window is opened and closed, or a homeowner sands down the door frame during a weekend renovation, it creates lead-laden dust. And this settles in the carpets where babies crawl, it coats the toys that they put in their mouths, and it lingers on the floors. And for a toddler, that hand-to-mouth transition is a direct route for a potential neurotoxin to enter their developing system. But this isn't just an indoor issue. If you live in a historically industrial area, you might be tracking lead-contaminated soil into your home on your boots every single day. This makes lead exposure both a home safety issue and an occupational hazard. So despite what some critics say about the CDC reference levels being too conservative, the science is settled. There is no safe level of lead. It is a persistent toxin that settles into bones and impacts the brain. For a developing child, even small amounts can lead to permanent cognitive shifts, behavioral challenges, and specialized education needs that families often have to navigate and pay for entirely on their own. For decades, Michigan's approach to lead testing was reactive and limited. Generally, only children on Medicaid were automatically tested. And while that it is true that most marginalized communities often live in older housing near industrial sites with a lack of access to quality care, lead doesn't check your tax bracket or your zip code before it causes neurological damage. And that's why the Environmental Council and our partners in the Michigan Alliance for Lead Safe Homes Coalition fought for years to pass universal lead testing. This landmark legislation recently went into effect, and it ensures that every child in Michigan is eligible to be tested at 12 and 24 months of age, regardless of their insurance status. We are now about 1 year into this rollout, and as the data comes in, we expect to see an increase in the reported numbers of kids with elevated blood lead levels. I want to be very clear about this. An increase in numbers is not a sign of a new crisis. It's a sign that we're finally turning on the lights in a room that has been dark for too long. However, testing is only the first step. It's not the solution. From a policy perspective, identifying a poisoned child is a failure of primary prevention, and we shouldn't be using children as lead detectors. This is why we're currently advocating for a $10 million state budget allocation to fund comprehensive nurse case management. Our local health departments have been chronically under-resourced for years, and we need dedicated nurses who act as a bridge for these families, professionals who can walk a parent through the overwhelming process of coordinating home visits, conducting environmental inspections to find the source of the lead, and enrolling children in early on educational services the moment they test above the 3.5 microgram per deciliter threshold. Alongside this, we are pushing for a massive workforce development. We need a robust pipeline of contractors who are trained, certified, and incentivized to take on lead abatement jobs. Our work at the Capitol is a long-term commitment. For over 15 years, we've hosted Lead Education Day, bringing together healthcare providers, environmental experts, and impacted families to speak directly to lawmakers. This advocacy is how we move the needle on drinking water filters in schools and the universal lead testing mandate. This year, our focus is on pushing a new bill package forward that addresses these systemic gaps. So what can you do right now? First, if you're hiring someone to work on your house, ask if they're lead certified. This actually matters. And you can also get informed about your own neighborhood. We put a link in the comments where you can see the reported lead levels in your specific zip code. Most people are shocked to see how prevalent this still is. And finally, you can write to your legislators to encourage them to support this bill package. You can find your local representatives and senators, as well as the specifics on each of the bills in the video description here. We have the tools to make lead poisoning a thing of the past in Michigan. We have the legislation in progress, we have the advocacy, and we have the data. Our historic homes should be a source of pride and not a source of permanent health struggles for the next generation.